This is a brief overview of the NeoData product. NeoData is a computer software program used by neonatologists to track their neonatal intensive care patients. NeoData is a software tool exclusively designed to support neonatologists and other medical care providers in the clinical management of NICU patients, from admission through discharge. The primary purpose of NeoData is to quickly develop accurate, detailed, and legible patient notes. All types of notes can be generated, including admission notes, daily progress notes, and discharge summaries. To generate a note, the neonatologist enters information about the infant and mother as discrete data values. The neonatologist decides how much data to enter. To reduce the amount of typing required, many data fields are selection lists. These lists are made for the NICU and can be changed by you. You can also define ranges for number values so that you are warned if you enter a value out of range. On many screens, you will find tools that help with entry of data or assessment of the patient. On this screen, we can display information about the weight, length, and head size as they compare to standards. You can also use the built-in New Ballard scoring tool to help determine the gestational age. There are many other tools available to the neonatologist, which we will show later in the demonstration. Let's take a closer look at some of the data that can be entered to generate notes. On the Select Patient screen, you see a list of current patients. You can also use the Patient Search function to find any patient who you have ever entered into NeoData. When you select a patient, you immediately see summary information about that patient at the bottom of the screen. To enter or view the detailed data, you select the screen you want on the left. Here we see information about the mother and her pregnancy. Again, many data fields have selection lists that can eliminate the need for typing. On this screen, you have information about the birth. You can enter information about the delivery, birth statistics, and any resuscitation actions that were required. Some of this information can be received automatically from other hospital systems by using the NeoData HL7 interface. On the admission screen, you have information about the admission to the NICU. If needed, you can also enter summary information about admissions to other hospitals. The pregnancy, birth, and admission data, along with other data, is used to generate a complete admission note. There are several screens that you can use every day. This screen is used to enter your physical exam. You can enter basic measurements and the vital signs that you want to include in your daily progress note. Several of these daily measurements of weight, length, and head circumference can be graphed. Different reference curves, including some defined by you, can be shown on the graph. You also have lists that help you enter your physical findings. Here, NeoData provides a tool to further build the detailed observations without typing. The respiratory support screen is another daily screen. Here, you can document the type of respiratory support the baby is receiving, along with some of the basic ventilator settings. You can also note problems with heart rate and respiratory rate. This is also the screen where you can enter blood gas values that you want to include in your note. Using the NeoData HL7 interface, the blood gas values can be automatically received into NeoData from the hospital lab system. The fluid screen can also be used on a daily basis to enter orders for enteral and IV fluids. For enteral fluids, you can specify the formula, strength, amount, schedule, and other information for the order. You can also drag up a previous order to reduce typing. There are many tools available to assist in writing IV fluid orders. For example, you can use the TPN worksheet to help define the components of a parenteral nutrition order. You also have a nutrition calculator, which can automatically calculate fluid totals, calories, and the quantities of important nutrients. This screen is used for miscellaneous information that you might want to include on your daily progress note. Information about current fluid intake along with general comments can be entered. The tracking screen is used to enter screening plans. It is also used to note when a screening study was done and a summary of the result. You can also start to enter and review discharge plans. These can then be included on a discharge summary. The diagnosis screen is used to track patient diagnoses along with the medications and procedures that are associated with each diagnosis. You can see that when we click on a diagnosis, the list of medications and procedures changes. Each medication and procedure is linked to a specific diagnosis. For each diagnosis, you further specify the diagnosis with a modifier and severity. And also track the onset and resolve dates of the problem. ICD-9 and ICD-10 codes can be pre-assigned to the diagnoses for use in billing and reporting. On a daily basis, you can comment on a diagnosis and also enter plans related to the diagnosis. The comments and plans are included in the daily progress note. You can view all prior comments by selecting the Old Comments option. You can also begin to develop comments that will be included on the discharge summary by using the Final Comments option. You can type comments or copy today's comments. With the radiology screen, you can log that a certain study was done and a summary of the results. The hematology and chemistry labs that you want to reference in your progress notes, or simply track during the patient's stay, can be entered. These labs can also be received into the NeoData using the NeoData HL7 interface to avoid typing. Culture results and drug levels can be entered on this screen. You can also define any additional labs you need as part of the Other Labs list and enter the results. Individual lab results can be graphed. When all the daily information is entered or reviewed, a complete progress note can be generated from that information. Here is what a progress note looks like. The progress note can be printed, signed, and put into the patient's chart, or sent electronically to the main hospital document system. The format of the notes can be set by you. During the patient's stay, you can document bills for admission, daily care, procedures, and discharge day management. You can simply check the billing level, or NeoData can suggest a billing level based on rules you establish. You or your billing staff can also print summaries of the patient status in order to support the daily billing levels. When you are ready to discharge the patient, much of the data you will need for your discharge summary note was entered during the course of the patient's stay. Summary information about key lab values, feedings, and respiratory therapy can be extracted from the database by clicking the Extract button. Additional discharge information can be entered and extracted. All of this information is used to generate a complete discharge summary in just a few minutes. You have many other tools available in NeoData to help in patient management and in the management of the NICU. For example, here is a view of key outcome measures for the patient. NeoData has a Vermont-Oxford link which can transfer data collected in NeoData to the Vermont-Oxford eNICU system. NeoData also has a very powerful alert system that can automatically generate alerts based on rules you develop. For example, if you want to be alerted if a lab value goes beyond a certain range, you can set that rule and an alert will be generated if the condition occurs. There are many predefined reports that help in the management and tracking of activity in the NICU. Here is a daily census report. NeoData also has a built-in reporting tool that allows you to create your own reports on any of the data entered into NeoData. You define what data will be retrieved and how it will be printed. NeoData has tools that can help the neonatologist with patients who are not currently admitted to the NICU. The consult screen can be used to document attendance at a delivery or a prenatal consult. You can quickly write a consult note for attending a delivery by using your predefined templates. Templates are available in many places within NeoData and are another tool that helps reduce typing. You then have access to a billing screen to assist in billing for these activities. After the patients have been discharged, the NeoData Clinic module can be used to track their visits to your follow-up clinic. You have seen the main features of NeoData, but there are many more tools within the product that help with the documentation of the NICU patient and management of the NICU itself. You can find more information on our website at www.isoprime.com or contact us at this phone number. You can also request a demonstration copy of the software at our website. Thank you for considering NeoData.